Each year, millions of U.S. residents travel to another country for medical care. And according to the CDC, the term for this is medical tourism, but it can often be risky.
Very risky. In today's Eye on Health, plastic surgeon Danielle DeLuca-Pytell breaks down the do's and don'ts of getting that medical care in another country. Thank you for joining us.
It's my pleasure. Thank you for having me.
So the first question, Danielle, this is something we hear about quite often, people going to try to get that cheaper surgery out of the country. Is that one of the driving forces behind this? Why do people do that?
Sure. So medical tourism is essentially done for a couple of reasons. One might be expertise. So somebody has a very rare cancer or a very challenging condition and they have to travel for the care of a specific, very skilled person. Or there's somebody who knows they have a recovery, so they want to travel to where their family is so they can recover with family. But overwhelmingly, and especially with cosmetic surgery, it's because the surgery is going to cost them a lot less. And sometimes it's wrapped up in a vacation package, so it sounds like you're really getting a vacation as well as surgery. It can be very misleading.
That's crazy. I didn't know that vacation package element of it.
Yeah, it can be really misleading because if you're contracting with a company that is promising you, beautiful sunrise and surfside activities, and you're supposed to also be having surgery, those things don't go together. You're not supposed to be sunbathing, you're not supposed to be swimming, you're not supposed to be drinking alcohol after surgery, you're supposed to be recovering. So it puts cosmetic surgery into a really dangerous light. It is real surgery, and surgery does also have real complications.
What are some of the things that people can look for or consider when they're considering doing this in another country or something similar?
Sure. So thank you for mentioning that, because medical tourism is also not just traveling internationally, but traveling domestically. Miami is a huge center for cosmetic surgery, and there are a lot of people in this area that travel there. So one of the things that people can do is they can look for certifications. So figuring out who the physician is that's going to be operating on them, making sure that the center is verified. I didn't know this until I started researching it, but there is an accreditation called the Joint Commission for International Hospital Care, very similar to what we have in the United States. So people can be doing their homework to look to see if the places that they're going to have been certified. Also, there are plastic surgeons that have been admitted into the American Society for Plastic Surgeons as international surgeons. So if they're going abroad, they can certainly look to see if the surgeon that they're going to see is part of that group. Those are some of the doing your homework things that can be helpful. It can also be helpful to make sure that you're going to be seeing the surgeon either in a telehealth or in another fashion in person before the surgery, so you don't just show up and then somebody is operating on you sight unseen.
Yeah. Right.
And this is definitely something where you want to do your homework. You had mentioned some of the amenities and add-ons that may lure people in. Are there any benefits to this at all?
From my point, not really. I am, as a plastic surgeon, I'm very, very conservative. My number one priority always is to keep my patients safe. So I can't think of any sort of reason that I would recommend to a patient that they should go out of the country to have a surgery that I can safely perform here at home, where they can be recovering with their family, where they are close to me, so if a problem does occur, they're not miles and miles away.
Right. The concern, though, that I'm thinking, is this a reflection of our insurance system? Because if you're talking about a hotel and flight and food and all of that, and it's still cheap enough to consider that over what we would consider home and safer, where's the problem?
Well, that's probably a deeper question. A little bit of a loaded question. So in this country, there are things that we come to expect. So I was talking about the certifications and verifications. All those things have some sort of a price tag attached. I carry medical malpractice insurance. That is a large amount of money that I spend every year that eventually gets rolled into the costs of me performing an operation. When we use devices in the operating rooms, for example, like a breast implant, that's a breast implant that's gone through FDA certification. So there's layers and layers of essentially hands touching everything that's done to make sure that everything is done in the safest way possible. Yeah. If you go to another country, maybe you're getting an implant that isn't certified. Maybe you're getting I know that in some countries they do free silicone injections. We don't allow that in this country. It's not that that's also not done here. It's unfortunately done by non-cosmetic surgeons as well. But that could be mechanical or industrial grade silicone that somebody's injecting. And you know, the problems don't usually happen until people get home. And then what happens?
And then what? Gosh, scary
Sounds like one of those things
situation.
where it's you get what you pay for, so you definitely want to be careful.
Yeah.
Danielle, thank you so much for your time.
Oh, you're
Yes,
very welcome.
You said use
Thank
your
you.
Groupon on your shoes, not on your body.
That is exactly right.
That's
Yep,
advice
gotta be
from the
careful.
plastic surgeon.
All
Okay.
right, let's